Well, weight loss, it's on the minds of many these days, and this morning we want to tell you about a minimally invasive procedure that's shown great success. It's called endoscopic sleeve gastroplasty, or ESG. And joining me now to talk about it is Dr. Christopher Chapman of Rush Medical Center and Colleen Vanderhei, who is a patient and has had ESG, had that procedure. Good morning to both of you.
Good morning. Thank you.
So, doctor, what exactly is ESG? How does it compare to other weight loss options or procedures, if you will?
Yeah, endoscopic sleeve gastroplasty is a non-surgical, minimally invasive approach where we use an endoscope to go through the mouth and do interventions on the stomach. And specifically, we're putting in sutures or stitches to tighten it down. Now, normally we think the stomach is very robust and it can expand like an accordion. What we do is we shrink it down by throwing in sutures and prevent that expansion again. And by doing that, people will lose weight because they have more restriction and they eat less.
Some people may say, well, that sounds scary.
Yeah, they may do, but it's actually shown to have less risk for having a complication or side effects. Usually these patients are having abdominal pain or nausea for 2 to 3 days, but they go home 90% of the time the same day.
Oh, wow.
And so they're usually back to work within 5 to 7 days too.
Colleen, I know you had the procedure. How long ago?
August 6th.
Oh,
this past year.
Just this. So tell me what made you decide to have the procedure, and how, if it has, how has it changed your life?
So I've been kind of overweight all my life. I've tried different diets. I studied different bariatric procedures. I found Dr. Chris and I decided to go with it. And I was home the same day. I had it like at 8 in the morning. And then like for I took a week off from work. I could have gone back probably 3 to 5 days because I was feeling a little nauseous that first couple days, then I was fine. And you're on a liquid diet for a while, and then I'm on regular foods. In fact, last night we went to Gibson's. And
yeah, that's regular food.
Regular food.
So how much, may I ask, how much
Sure.
weight have you lost?
So when I first met Dr. Chris, I was 266.
Okay.
My surgical weight was 254. I'm about 219 now.
Okay, and that's since August.
That's since
and
August.
And you feel good?
Oh, yeah.
So then, well, that's wonderful. I'm sure there's so many life changes that go with that too, other than just losing weight, I would imagine.
Yes, I was taking off my high blood pressure medicine. I'm able to walk more. I initially needed it because I probably need knee surgery, which has, because you've lost the weight, there's less pain in the knee now.
So, doctor, we're talking to Colleen, and then I know someone I work with has had the procedure, and she said it changed her life. But who is a good candidate for it? Who's the ideal candidate for this?
Yeah, so the procedure is FDA approved for a BMI between 30 and 50. So anyone within that BMI target would be someone who could be a candidate for the procedure. But I think we really are trying to evaluate this individually to see what is the best option for that patient. For some people it's medications, some people it's true bariatric surgery, but we think this minimally invasive approach may open up a lot of opportunities for any patients who are considering providing something extra for their weight management journey.
And is it usually covered by insurance? Because of course that's going to be a huge factor for people.
Right. So there was a big struggle when it first started. I've been doing these since 2017, and there was predominantly self-pay in the beginning, but recently we've seen significant uptake by insurance companies. And they've seen how much GLP-1s, these new medications, can be not really cost effective. So that's why we're looking at these minimally invasive approach, because we have good data showing that one procedure can have durable results out to years, whereas if you stop the medications, you're really at risk for having weight regain.
And Colleen, real quick, I know everyone's different, but would you recommend it?
Oh, yes, and they have a good team that have been supportive, and my physical therapy people at Integrated Physical Medicine have been very supportive of this project.
Well, I really appreciate you both of you being here to talk about this procedure and also its personal impact on your life, Colleen. So, Dr. Christopher Chapman of Rush, Colleen Vanderhei, thank you so much for being here, and really interesting information.
Thank you so much.
Thank you.